Let me ask you, have you heard this, Chris? You know, especially many of our team members in 1199 are young. They have children, young children. They're, you know, thinking about childbearing. What do you say when you hear, I'm hesitant or I'm not sure about, you know, how this might affect my unborn baby? Or what are your thoughts on that?
Very, very important topic. I think this is one of the most frequent questions I get when I'm in community, whether virtually or through friends and social networks. What we know is that while the vaccine trials weren't involving pregnant people, we do know at this point well over about 114,000 pregnant people have been vaccinated. And roughly around 4,000 or so are actually being tracked through something called V-Safe. It's a monitoring and safety app that you can use on your phone. And that real world data is powerful. Because what we've been able to learn is that those who choose to get vaccinated have not had worse health outcomes or birth outcomes. So the conversation that I have with people in community and with team members is that there is nothing in the science that would suggest that this would be harmful to a pregnant person or harmful to an unborn child. Is that science still building? Yes. And it's very important to be able to say that to people. And two, just understanding the science, the technology itself for two of the vaccines, messenger RNA, okay? And so basically, it's the body using machinery, tools that it already has to make proteins. There was some concern if the body was being designed to fight against proteins, would that interfere with a protein around the placenta? But again, we know from the whole gamut of data that we now have that that isn't true. So I encourage people, bring questions like that to the table.
Yes.
And give science the space and the opportunity to answer. So bottom line, everything that we know up until today points to the safety and effectiveness of these vaccines in pregnant people, breastfeeding or lactating people, and that it does not interfere with fertility.